My name is Dr. Michael Greger, founder of the nonprofit website nutritionfacts.org. Every year I read through every issue of every English language nutrition journal in the world, so busy folks out there don't have to. And I compile all the most interesting, most groundbreaking, the most practical findings into new videos and articles I upload every day to the website. Everything is free, no ads, no commercial sponsorship, not selling anything. In fact, all of my proceeds from my books, DVDs, speaking engagements, all goes to charity. I just do this as a public service, and actually all goes back to my grandma, who when I was a little kid, was diagnosed with end-stage heart disease at age 65. Confined to a wheelchair, crushing chest pain, already had multiple bypasses, and sent home to die. And then she heard on 60 Minutes, Nathan Pritikin, she's one of his first patients. They wheeled her in, and she walked out and lived another 31 years on this planet with her 6 grandkids, including me. And that was the day when she came out that I knew I wanted to be a doctor. But then in medical school, they didn't teach. I mean, by then, Ornish had published in The Lancet Lifestyle Heart Trial, reversing our #1 killer without drugs, without surgery. And if that didn't get out there, if the cure to our #1 killer, then what else was there in the medical literature that I didn't learn about in medical school? That there wasn't a financial motive, there wasn't a corporate budget driving its promotion out there. And so I made it kind of my life's mission to go back into the literature and look at this incredible mountain of research. It's not like it isn't there. It's not like the studies haven't been done. Now, in the age of the internet, now people can take their life and their health and their family's health into their own hands and educate themselves. They don't need to rely on so-called professionals. The low-carb movement keeps coming back over and over again in different faces, and each of them swears, "Oh no, I'm not like the last low carb. No, we tweak it a little bit. No, but I mean, they're very similar manifestations, and of course they sell lots of books. Any book that says bacon is good for you is going to sell a lot of books. But what troubles me is, this isn't an academic debate. This isn't an academic discussion. Who's right, who's wrong? It's people are going to listen to these and actually hurt themselves, hurt their families. People are going to die. What's our #1 cause of death? #2 cause of death? Go down the list. These are largely diet-related diseases, and to tell people to eat these kind of diets it's not that it's not based on science. The science is the opposite. This is not the Dr. Greger diet versus the Dr. Atkins diet. It's the science. It's centuries of science versus the latest fad that someone wants to sell books over. And it's ironic to me that the foundation of these theories tend to be that carbs are bad because they increase insulin production, and insulin, having high levels of insulin associated with cancer, associated with lots of bad things. But meat is insulinogenic. There's a paper by Holt and colleagues, 1997, American Journal of Clinical Nutrition, called, in fact you can look it up, it's probably free by now, Insulin Index of Foods, and it says you eat this much of, and they went through about 50 different foods, and eating beef causes a greater spike in insulin than white potatoes and white pasta and white rice. More insulin, and if that's the villain, right? Then you'd stay away from the meat. Even using their own framework, you would eat the opposite thing. And I mean, the cause of prediabetes, the cause of type 2 diabetes is insulin resistance. What causes insulin resistance? It's intramyocellular lipid. It's fat that's inside the muscle fibers that interferes with insulin signaling such that your body has to keep pumping insulin to try to force it into your muscles, which use about 85% of your blood sugars. Your blood sugars rise because they can't enter into the cells, and not just any fat, but particularly saturated fat is toxic. So it's called lipotoxicity. I mean, that's the term that's used in the literature to describe the effect that saturated fats have on the insulin on producing insulin resistance. And we can do this. It's not just epidemiological studies. Studies back in 1927, they took these medical students, put them on a high-fat diet, and within days, their insulin sensitivity dropped. They had twice the blood sugar spike to the same meal that people that were on the kind of high carbohydrate. Twice the blood sugar response, just 2 days eating these fatty foods. And we now know, and now we do these lipid infusions. You can actually infuse fat, and within hours, we can see insulin resistance appear, blood sugar start to go up, your body has to churn out that extra insulin, and we have fancy drugs that can actually pull fat out of your system, and insulin resistance drops, and it doesn't have to be in the vein. The fat can go in your mouth too, and we have the same thing, and the effect is almost instantaneous. Literally within days, or within hours, within days, we can get this insulin resistance, and that is what leads to these diseases. Now, diabetes is the 7th leading killer. It's an epidemic. It's now becoming a pandemic around the world as developing countries are starting to take on the rich Western diet. And I mean, it's just an absolute tragedy. And they're telling people to eat exactly what's causing the disease. In fact, that's why obesity is associated with diabetes, because you can get fat in your bloodstream, which gets in your muscles, 2 ways, either through your mouth or your fatty tissues. Actually, there's what's called a spillover effect. Actually, your adipocytes, the number of fat cells you have after about age 20 is about the same. The reason your butt, thighs, and stomach gets bigger is just your fat cells actually fill up with fat. They swell. You don't get more fat cells. They just get bigger. And when they stretch to a certain point, they start spilling fat over into your bloodstream, and that gets lodged in your muscles, and that can spill over, get lodged in your liver, and cause insulin resistance in your liver, make things worse, and then can actually lodge in the pancreas, in the insulin-producing cells of your pancreas, and then you can actually get that same lipotoxic, that fat toxicity, in your pancreas that reduces, eventually reduces the amount of insulin you can produce, and then you're in florid type 2 diabetes, which is the #1 cause of blindness, #1 cause of non-traumatic amputations, #1 cause of kidney failure in this country. These are horrific complications. And what does modern medicine have to give them? Just trying to reduce the complication rate. Just not treating the underlying cause, and we can cure this disease even years into the process, which is really exciting. It's not like, we used to think, we just kind of kill off these betas of these insulin-producing pancreatic cells, but it's actually, maybe we're just kind of suppressing them. And we can actually kind of wake them back up if we actually eat a cleaner diet, reduce that fat. Diabetes is a disease of fat toxicity in our organs, in our muscles, in our liver, in our pancreas. My mission in life is to help make people make evidence-based, science-based decisions as to what to feed themselves and their families to prevent, treat, even reverse chronic diseases that are laying waste to our society. I put all my work up free, nutritionfacts.org, and the science points to a diet centered around whole plant foods.